let's see what happens. Let's sit in there and let's do photobiomodulation. So I buried the implant underneath her gum tissue so she couldn't put any pressures on it, anything like that while it was healing. And she came in for photobiomodulation once a week for those 4 months. And we opened it up yesterday and I torque tested it and it torqued to our 35 that we needed. So she gets to put a tooth on top of it. So that was just a great example of a patient that may not have integrated had we not done something like that. She had history of implant failure in the past. She was told she couldn't have implants. We utilized this type of therapy to be able to help her. I did think for her that had she had a panel at home where she could also be microdosing even beyond the once a week she comes into my office, how amazing that would be and how that could help her just overall with her overall health. So I absolutely think that those are things that if we can start to incorporate that and just make that part of the care and part of our treatment plan, that's great. The hard part is, depending on the different workflows in the office that somebody may be in, is how do we take this chair time to be able to do all of these different steps? So for me, even starting to incorporate laser, and I utilize lasers to do my extractions and decontaminate sites and do all of that, it was a change in flow that at first it took me longer to do my extraction that way. So it makes you think as the clinician when you have to see a certain number of patients in a day, well, is this sustainable? Can I take longer to do this? What I can say though is since I've been doing the protocols I have, my 2-week post-ops look like 1-month post-ops. My 1-month post-ops look like 3-month post-ops. So I'm accelerating that healing. It's almost like my insurance policy that I know that my surgery is going to go well, my patient's not in pain, they feel good, and we're going to have an excellent outcome. So that's the reason for me of why would I spend a little extra time on the front end to be able to ensure that I can have that outcome on the back end.